All right, this is lecture 8, and it is the final installment on grant writing. So it is definitely important to view 6 and 7 before this one, otherwise this really won't make much sense. So in lecture number 7, we talked about specifically what we've done with our child maternal health program, how we've broken it up into an infant, and maternal health program, which is brand new for us, which we're going to start now with this new grant, with our school and maternal health program, which has been going for a number of years, our preschool maternal health program, which has also been going for a number of years, and of course our adolescent and maternal health program, which has also been going for a number of years. So, of those 4 parts, the infant maternal health program will be the one that we will start at this time. So the question then comes as to why is this important? Why did the ADEO.org people see this as a revolutionary change? Well, basically the way I've spent 35 plus years on dozens and dozens of trips all over the developing world. And what you basically see in healthcare is that the healthcare system being used in the developing world basically came out of what is in the industrialized world, and it's pretty much hospital and clinic based. And there have been improvements. Certainly the addition of community health workers over the last 20 years and using them to greater advantage has become extremely important. But in general, that system doesn't work very well because it still relies on, for most of the population, to come to clinics and hospital, not only when they're sick, but for preventative service and education, and they basically don't do that. The ability to go to them with community health workers has been a definite advance as we go to them, and therefore we can bring these this education, many of the prevention modalities like immunizations and bed nets and clean water treatment and hand washing right to the home. The problem is, when we began this in Kenya, if you look at the cost of going from home to home, it's extremely high. So what we're doing is we're looking at the key group, which is, we've already discussed, is the mother and child, and where do they most congregate, and that's obviously around the schools. Because pretty much in every country there is a school program. Children do go to schools, and the mothers are very familiar with those schools. So by running the program out of the school system, you get huge jump in efficiency as the mothers are almost always within a 1-hour walk of the school. It's something that they're used to. It's something that they frequent. Extremely important. Also, because we are partnering with the Ministry of Education, we do not have brick and mortar costs. We are allowed to use their facilities, and that's a huge, huge savings. So the ability then to take care of a mother when she first conceives till when she and her child leave school at whatever age then becomes very doable. The other thing is that in the last 20 years in my consulting, so many of the programs are really one-dimensional. They focus on HIV education. They focus on improvements in child maternal health, maybe in the sense of focusing just on women that are pregnant, or maybe they focus on just on children in the first year of life. Our program is really integrative and comprehensive in the sense that it takes a woman from the time of conception right through to when her child leaves the school system. And it offers curative services as well as prevention with bed nets and clean water and soap and vitamin A and so many other things. It allows then a woman to have a safe place to go where she can get good medical advice without significant cost to herself. And of course, this is backed up by our 24-hour, 7-day-a-week free health hotline. So that is the revolutionary aspect of our program, the ability then to piggyback critical health care on the critical unit, that is the mother and child, onto an existing system of education and schools within whatever country you're dealing with. Now, this is not mutually exclusive. I'm not suggesting that we should stop the clinic-based program or their community health programs, whatever they may have. It runs parallel to those programs, but this is a very cost-effective ancillary program that can go along with the existing structures in whatever country, in this country, Kenya. And I can say that in Kenya, the governmental health clinics are in significant and serious disarray, as they are in much of Africa and a lot of the developing world. Recently in our own area, one of the government hospitals that we sometimes have to send our patients to, the government did not pay the hospital. The local water system shut down the water in that hospital, and that hospital was carrying water from buckets from a river for a number of weeks. And if you can imagine running a hospital that way. So there is a great need for this kind of program. Now, one of the things I talked about early in Lecture 6 is very important. I want to go over, and that's the authenticity situation, because any foundation is going to say, one, are you authentic? Do you do what you say you're going to do? And does the money that we give you, is that going to go to that program? Well, the first thing to say is that we have a wonderful documentation letter here from the Ministry of Education that was given to us. It was unsolicited, and it basically documents what we've done. And I would like, it's very short, I just would like to read you that because this is a signed and stamped letter. It says, this office wishes to convey our sincere thanks and appreciation for the support and services of Village Hope Corps International, including that the organization has contributed in more than 200 secondary and primary schools in the provision of clean water, water tanks, hand washing stations with soap, mobile clinics, health education to children in schools, mosquito nets to all entry pupils, and education on responsible relationship with the youth in 50 schools, support of the national examination program with the use of our vehicles. So that's an extremely important letter because it documents to any foundation that the end recipient, which is basically the school system, can document what we've done. The other thing is the actual following the money track. And certainly the first thing are the audits. And any good organization has to have a good bookkeeping system and has to have certainly an external audit, which we do, and also an internal audit. Not all do, but we have a good internal audit where we actually bring somebody in from Nairobi to audit us every quarter. Because that person is paid, it has to be considered an internal audit because we pay that individual. But really what we've done is basically create a system of 2 external audits. But the problem with audits after 35 years of consulting and looking at these organizations, when I look at them, is unfortunately audits and books can be modified. Now, books can be cooked if you wish. And that can be a significant problem in the developing world. So when I view a foundation, I very much look at all those numbers first, but then I look at the principle. Who is the leadership of those organizations? What is the history of that leadership? And what do you know about those individuals? And are those individuals authentic? Are they honest? In this case, the 2 individuals really involved since the beginning of AT, there's only 2 of us. One is Dr. Mugambi, who basically born in that village, became a lawyer in the United States, became a citizen of the United States, and has now returned back to Kenya working in just a fraction, probably 1/5 or 1/6 of the salary that he had when he was living in Culver City. He sold his home there and now is living in the village of his birth to operate this program. And I have been so lucky to really have a partner in this program that is honest, committed, and passionate. So it's been a great privilege for me to do that. As far as myself and those of us in the board from the United States and the board, and our side has been responsible basically for bringing in all the funding for the project. None of us are paid. All of us have volunteered our services. All our office space in the United States, all our phone service, all our secretarial service, all our accounting fees, All that is donated services. And there are no hidden perks. We don't get travel expenses when we go to Kenya. We don't get lodging. We're committed and passionate about what we do, and we donate those services. Now, the reason we can do that is we've all been very successful in our particular careers. And it is a great pleasure, I think, for all of us to be involved in this. All of our board members have been to the villages. I know from my situation, the chance of ending a career with a project like this that I have really been the major medical architect of and has been a success. It's an incredible, incredible situation. Very few of my colleagues have had that experience. And to our staff in Africa who's seen this, our 50 employees, I want to thank you so much for what you've done, how you've made these ideas a reality within the school system. I think getting this letter from the school system, it just validates the incredible work that you have done. And certainly your work was culminated this last month when the Ministry of Education in our school system asked us to partner with them in a program where we're going to have a teacher health champion in each of the 200 schools. And it's in a partnership where we have now trained those 200 teachers. We will train them every quarter. The Ministry of Education has designated which ones will be the health champions. Those teachers will be responsible for taking care of the clean water, the hand washing soaps, and running the health clubs. The health clubs then will take in our school to community program the clean water and the hand washing and bring that back into the community. Again, that has been a revolutionary program according to the Ministry of Education. That has never been done before in the 12 million school children ministry within Kenya at this time. So I think for authenticity, I think looking at the audits, looking at the two principals, myself and Dr. Mugambi in our experience, as well as looking at the references of the 6 foundations who have supported us for so long, who continue to increase our budget. Those letters of reference then become very important for any new foundation. So I think to end this, to our grant writer, who is Ann Gilday. She's been with us in Africa for 4 years. She's from Boston. She was there for the first 2 years as my Global Health Fellow, and then we advanced her to management to help us restructure our organization, and now she's working as our grant writer and fundraiser living in Nairobi, and she will be the one writing this grant. I think for you, Ann, this may be one of the easiest grants you'll ever write, because basically you don't have to embellish anything. You can talk about exactly what we've done, the fact that we have an 18-year history, that we've won a major international grant award that has peer-reviewed what we've done, that we have references from our foundations that have supported us, that we have this unsolicited letter from the Ministry of Education that documents our services, and more importantly, the thing that I didn't read you is the last part of the letter from the Ministry of Education saying, through your support, our school system has seen improved hygiene and good health amongst our pupils and students. This has impacted positively in enrollment, which has increased significantly. The national performances in the KCPE and KCSE tests also have improved compared to other sub-county. The Office of Education pledges to continue with the cooperation and collaboration to ensure that both the ministry and Hope Corps achieve their objectives individually and collectively. So I think, Ann, with all that, we can write a very strong grant program. And again, it's been a great pleasure. We will then now move on and continue with the rest of our core concepts in global health.